This is one of our best COVID response facility, which has been burnt down. This was a 70-bed ward, but now it's been burnt down. We hope to appeal to everybody to support us to put back this facility to where it was. In 2022, I showed you how the fire destroyed this isolation treatment center for COVID. With the general support of the World Bank, we've been able to reconstruct this facility, equip this facility to reinstate the services that we've been doing. Currently, we are providing the much needed services for the Rohingya refugees. The Severe Acute Respiratory Infection Isolation and Treatment Center has been repurposed as an integrated infectious disease treatment center, which plays a critical role in managing potential disease outbreak within the Rohingya refugees camp. It is served as the central hub for the admission of dengue patients during the upsurge. The center effectively manages, isolates severe acute respiratory infections, COVID-19, diphtheria, measles, and acute water diarrhea. This center has a dedicated gene expert lab which provide diagnostics for tuberculosis, HIV, and COVID-19. It has the potential for extending these capabilities to include hepatitis B and C. These facilities contribute significantly to addressing the health challenges faced by the Rohingya community in the camp. As IOM, we are committed to providing quality health services for the refugees and the host community in Cox's Bazar.